Assalamu alaikum. Today we are accompanied by Miss Wardha Zahid, who has been doing psychology for more than 6 years at Umar Hospital, and we are going to ask her a couple of questions on the topic neurodivergence. So, to begin with, we'd like to take your professional opinion in what can be classified as neurodivergence and how do they commonly manifest in the youth or adolescents.
Well, I really admire the topic you have chosen. I would like to mention some disorders that is easy to identify, especially in teenage. Like if kid is having anxiety issues, he may have OCD later. Similarly, anxiety is a big term. It leads to so many other things like overthinking, like unable to focus, and then not being really participative. And sometimes kids have social anxiety, they are unable to communicate their feelings, their needs and desires. So it's about anxiety. And when it comes to depressive symptoms, some of the kids are going through really hard time coping up with sometimes with environment, or because of the childhood traumas. They may exhibit some depressive symptoms. They lag behind in studies. Sometimes they're not very engaging in the social activities. So kids those kids needs to be included. We should show some more empathy towards them. Teachers should take care of what they're up to. Or what neurodivergence is, basically the signs are from childhood. If the kid is not meeting his or her milestones, that means he or she is far behind than the standard milestone meeting age. You get it? So that's how it goes. And other than that, a lot of assessment procedures can be done so that we can identify what the kid is up to and how it can be improved individually.
Okay, very well answered.
Thank you.
In your professional life, how often do you come across cases actually revolving around neurodivergence?
Well, in Pakistan, a patient goes to multiple doctors for different type of symptoms. For example, if somebody is going through stomach issues, IBS is diagnosed later. First, he may go to a lot of diagnostic treatments and tests and this and that, and later they realize कि okay, this is IBS. तो हमारे यहाँ चूँकि बहुत ज़्यादा हम इतने ज़्यादा अवेयर नहीं हैं साइकोलॉजिकली, तो लोगों को इस बात का पता ही नहीं चलता. दूसरा, ज़रा से पैनिक अटैक होता है, हमें लगता है ब्रीदिंग इश्यूज़ हो रहे हैं, तो हम सबसे पहले पल्मोनोलॉजिस्ट के पास जाते हैं. या हार्ट के इश्यूज़ हो रहे हैं, हार्ट बीट तेज़ हो गई है, पीपल गो टू कार्डियोलॉजिस्ट एंड थिंग्स लाइक दैट. और बहुत सारे और भी चीज़ें होती हैं, जैसे सिवियर केसेस में डिप्रेशन अगर अंडरलाइंग हो, फंक्शनल डिप्रेशन हो, तो बाज़ लोगों को स्किन की डिजीज़ भी हो जाती हैं, तो वो डर्मेटोलॉजिस्ट के पास पहले जाते हैं. फिर डर्मेटोलॉजिस्ट उसका इलाज करते करते साथ में उनको रिकमेंड करते हैं कि गो टू साइकेट्रिस्ट और साइकोलॉजिस्ट टू अंडरस्टैंड कि हाउ इट्स गोइंग. या
A very innovative answer.
थैंक यू.
Do you think people suffering with mental disorders are treated inferior to others who are perfectly fine? If so, how do you think we should deal with this?
Well, thank you for asking this question. It was much needed. Yes, children, young boys and girls, even adults are not treated nicely if they are going through really a hard phase or maybe some mental disorder. So, I think it is a very, very versatile field, being a human, that every human is different and we don't need to put anyone in any box or in any category, because this rat race or be in someone's shoes or be like here or be at the top position is nothing I would say is recommendable. But coming back to your question, how can we help? We need to understand the individuality, the uniqueness, and how a human can be versatile. So if someone is slow, we need to be really kind and empathetic towards them, that yes, he or she is slow. And if somebody has really fast pace in talking or doing things, or he's little impulsive regarding things, it's fine either. So we should be more considerate, more gentle towards our friends, towards our cousins, towards anyone on the street even. It depends on us. Change comes within.
Very nice answer.
Thank you.
What are the signs and symptoms parents and educators should look for upon identifying early signs of neurodivergence?
ओके, साइंस बहुत छुपे हुए होते हैं, दे आर अंडरलाइंग एंड एवरीबडी शुड बी अवेयर ऑफ इट कि इफ़ द किड इज़ नॉट अपीयरिंग इन स्कूल और इफ़ ही और शी इज़ नॉट हैप्पी and if somebody is so much into fights or so much into bullying, that means they need help. अगर बच्चे को बहुत ज़्यादा tantrums हो रहे हैं, crying spells हो रहे हैं, तो क्या reasons हैं that he or she is not being able to keep the pace? तो ये सब साइंस हैं. इसके अलावा अगर बच्चे का दिल नहीं लग रहा स्कूल आने का या स्कूल में बैठने का या और सोशल एक्टिविटीज़ में, कि वो खेल भी उस तरह से नहीं रहा जैसे बाकी बच्चे खेल रहे हैं, तो आई थिंक दीज आर द साइंस. इसके अलावा हमें पेरेंट्स के साथ मिलके इसको एड्रेस करना चाहिए. और जहाँ पे आपको लगे कि इफ़ योर फ्रेंड is not that happy or emotionally available as he used to be, तो क्या वजह है, वी शुड आस्क देम. और अगर हमें लगता है कि हम पर्सनल लेवल पे इसको सेटल नहीं कर सकते हैं, तो वी शुड आस्क फॉर प्रोफेशनल हेल्प. सम एडल्ट्स इन्वॉल्व करने चाहिए, या फिर कैंपस काउंसलर और अ क्लिनिकल साइकोलॉजिस्ट इज़ रिकमेंडेड टू विजिट.
Great answer.
थैंक यू.
What are the most effective treatments and interventions available for managing neurodivergence in children and adolescents?
Okay, treatments are multiple. There are multiple treatments. There are multiple people who work as a team with a kid going through this all problem. Well, there are speech therapists, there are child psychologists, then there are neurologists, then there are psychiatrists who are involved in that, and then clinical psychologists are also involved in that. You know, it's not for one person. अगर हमारे यहाँ ऐसा है कि अगर एक पर्सन को डायबिटीज़ होती है तो उसका ज़िम्मेदार वो खुद होता है, दैट ही इज़ गोइंग थ्रू सम फिज़िकल सिम्टम्स. लेकिन अगर किसी बच्चे या बच्ची को न्यूरो डाइवर्जेंस का इशू है, या वो इंटेलेक्चुअली डेफिसिट है, या उसको डिफरेंट किस्म के इश्यूज़ हैं, या उसके एंगर में बहुत ज़्यादा प्रॉब्लम आ रहे हैं, उसकी कम्युनिकेशन में प्रॉब्लम है, तो उसकी वजह से पूरा माशरा असरअंदाज होता है. सो व्हाट आई एम ट्राइंग टू से इज़ इट इज़ अ टीम वर्क, जिसमें पेरेंट्स की भी साइको एजुकेशन, उनकी काउंसलिंग बहुत ज़्यादा ज़रूरी होती है. ये सब चीज़ें इसमें मैटर करती हैं. ओके,
You're very well answered.
How do you say different cultural or ethnic groups react to one of their own being diagnosed with neurodivergence?
Well, yeah, हर culture में there are differences, and because psychology is originated from West, so they are more aware, they are more acknowledged, they are more knowledged, and they know things far better than us. तो obviously उनके यहाँ जो भी problems होते हैं वो शुरू में ही diagnose हो जाते हैं, because their healthcare system is quite developed, because they are more equipped mentally and in all the aspects. So when it comes to psychological issues, yes, they are more aware and they know things very well than us. तो उस तरह से उनका hard reaction acceptance में नहीं होता जितना हमारा होता है. दूसरा, they have accepted it far ago. We are still taking time to accept that, yes, if somebody is diagnosed with ADHD or you can say OCD or any other disorder, people take a lot of time. हमारे यहाँ तो अभी भी लोग जो हैं वो हकीमों के पास और दम दरूद कराने के लिए जाते हैं शिज़ोफ्रेनिया को लेके, when it can be accepted शुरू में ही, और जिसकी वजह से इसको मेडिसिन के थ्रू ट्रीट किया जा सकता है, और थ्रू थेरेपी भी sometimes. Yes.
Very well answered. Well, that concludes our interview. Thank you very much for your time.
This has been a really insightful experience for us all.